Okay, well, Liz Bonis just back talking to local doctors today. What do we need to know now?
It is interesting and, of course, always a little bit alarming when you hear about another death from Ebola, especially when it's here in the United States. But infection control specialists at TriHealth's Good Samaritan Hospital say this is the time to be alert but not alarmed. Now, I talked to Dr. Blatt at TriHealth. He has been tracking diseases like this virus in our area for years. He says there is a vaccine in the works for Ebola, much like the flu vaccine. It would be given to those in Africa and other countries most at risk. It's been proven effective in early research, but still needs further testing. So until we have that, here is what he thinks all of us need to know about Ebola.
Well, I think, although Ebola is a scary disease because it has a high mortality rate, the risk of getting it is incredibly low. For the people who are living in West Africa, I mean, it's a real threat. For people living in the United States, it's not an issue.
So right now, it's your hands that are your best defense if you wash them against a virus or any virus. Keep in mind, Ebola is a tougher spread. It's spread only through bodily fluids. The flu, however, which we're moving into flu season, you can get through a cough or your sneeze. That's why they say sneeze in your sleeve, please. Yeah. That little thing that makes such a difference for all of us. And the good news is, so far one death, but he does not think this will continue to spread.
No, I mean, I'm trying not to have fear, but I have felt isolated. My husband came home last night and he said they have people coming in their office from Nigeria. And it made me kind of take a step back and think, there you go, are we,
We are around them every day, though. We have an international airport.
We do.
So the important thing is to remember how this is spread. Very close contact with another person. Yeah. The flu itself, much more easy to get your flu shot.
All right, thanks. Oh, it's good advice. Thanks, Liz. Now.
Ebola patient diagnosed in the United States dies today at a Dallas hospital. Local infection control specialists at TriHealth say this is the time to be alert but not alarmed. There's a vaccine in the works for Ebola that's proven effective in early research but still needs further testing. Here's what doctors think we need to know in the United States.
Well, I think, although Ebola is a scary disease because it has a high mortality rate, the risk of getting it is incredibly low. For the people who are living in West Africa, I mean, it's a real threat. For people living in the United States, it's not an issue.
Hand washing is your best defense against any virus. We're told Ebola is more difficult to spread because it's transmitted through bodily fluids.